Hi there, today I want us to talk about jaundice and how jaundice causes cerebral palsy. So what is jaundice? Jaundice is a yellowish discoloration of the skin and membranes, and it's caused by a pigment called bilirubin. So where does this bilirubin come from? So bilirubin comes from the breakdown of red blood cells. So the red blood cells are broken down into hemoglobin, and bilirubin. So we're interested in the bilirubin. So the bilirubin that comes from the red blood cell is called unconjugated bilirubin, or we'll say toxic bilirubin for this video. We'll call it toxic bilirubin. So this bilirubin, I'm calling it toxic because this bilirubin is fat soluble bilirubin. So it basically dissolves in fat. Now the problem with molecules that dissolve in fat is that these molecules can easily cross the blood-brain barrier. Okay, so you have your baby and your baby's brain is still developing, and you have this molecule that can easily, this toxic molecule that can easily cross the blood-brain barrier. So this bilirubin causes toxic brain injury. So it causes death of some brain cells in the baby, and it's very hard to notice at that moment that there's been injury to the brain because your baby is still growing. The baby is at that point not doing much, especially like during the first month of life. The baby is not doing much. The baby just cries, feeds, sleeps, cries, feeds, sleeps. So it's very hard for you to actually tell that there's been injury to the brain. So this injury usually manifests later on in life, when your baby is supposed to support their head, they're unable to support their head. Your baby is unable to sit without support. Your baby is unable to stand. Your baby becomes stiff. You know, like it manifests later on. Then you come to the hospital. And one of the questions that we're going to ask you, and I'm sure parents who have babies with cerebral palsy have been asked this question, like, was your baby jaundice? Did your baby ever appear yellow? That's one of the questions that we ask. So that's how jaundice can cause cerebral palsy in a baby. It's because it causes toxic brain injury. So the bilirubin goes to the liver. We've gone back to the bilirubin. So when it goes to the liver then conjugates it, basically detoxifies it and makes it water soluble. So then this water soluble bilirubin is excreted through the urine, and it's also excreted as urobilinogen through fecal matter. So jaundice can either be caused by elevated levels of unconjugated bilirubin or by elevated levels of the conjugated bilirubin. And we've heard stories of mothers saying that when they noticed that their baby was jaundiced, they just sat in the sun. They were told to sit under the sun. Well, first of all, you don't even know the type of jaundice that your baby has. And yes, the whole sitting under the sun, it comes from one of the treatment modalities that we offer, which is phototherapy, where we put the baby in blue light, and this light then converts the fat soluble bilirubin to water soluble bilirubin that can be excreted through urine and feces. But you sitting under the sun you may be underdosing your baby with that light, because sunlight has different wavelengths. So you may not know which wavelength that your baby is receiving. You may not know the amount and maybe the duration that you need to be in the sun. So you coming to the hospital is better, because one, we're going to be checking the levels of bilirubin in your baby. We are going to time how much light your baby is going to need and for how long. Like the duration will tell you, okay, you can now breastfeed your baby. Your baby needs to be in this light for this many hours, you know. So it's not, I know it's not something easy. Many people will avoid coming to the hospital because they don't want to be admitted. But you sitting under the sun with that baby who's jaundiced I don't think it's helping the baby. So it's better you come to the hospital It's better you are seen and you get the proper treatment, because the jaundice also needs to be investigated. There are various causes of jaundice. The jaundice may be physiological jaundice. It may be part of the normal development. It may be pathological jaundice, which is now a problem. Your baby you may have maybe a syndrome where the enzyme that conjugates the bilirubin is insufficient. They may have infections, overwhelming infections that may cause the red blood cells to start degrading at a faster rate. It may be due to the blood type of your baby. So there's so many causes, and you need to have that baby evaluated. So if you notice that your baby is looking a little yellow, or you're not sure whether your baby is yellow or not, it's better you come to the hospital so that we can assess and tell you whether your baby is yellow or not, and whether the bilirubin levels in your baby are normal or not. Yeah, so that's it for today. This was Dr. Yvette. Bye.